potential infertility problems with the fallopian tubes. Each month, a woman's ovaries release 1 or 2 eggs to be fertilized. In order for the egg to get to the womb, it must first travel through the fallopian tubes. The fallopian tubes connects the ovaries to the uterus. If a woman does not have healthy tubes, then her eggs may not become fertilized or even enter the uterus. There are several ways that tubes can become damaged. The most common ways that tubes become damaged are by infections and endometriosis. It is worth noting that a woman does not necessarily need to have both of her tubes clear to become pregnant. However, her overall chances of conceiving are lower if just one of her tubes are blocked or damaged. Many women struggle with endometriosis. It is explained in more detail below. Endometriosis can be a source of pain in the pelvic area and can be felt during intercourse, menstruation and even bowel movements. It affects over 12% of women who are of childbearing age and affects nearly 40% of women who have been diagnosed as infertile. It appears that the chances of having this condition are higher for women whose mothers have had it. Endometrial tissue lines the uterus. This tissue divides and then thickens quickly during a menstrual cycle when the body anticipates the presence of an embryo. An increase in nutrients is also carried to that area as blood flow increases. Endometrial cells can travel to areas outside of the uterus, including the pelvic cavity. These cells continue to divide and latch onto organs. This can cause complications that are associated with endometriosis. The endometrial tissue can be present on many internal organs. However, a strong immune system should recognize and destroy these misplaced cells. The endometrial tissue needs estrogen to grow. Lupron and other drugs are commonly prescribed in effort to reduce levels of the circulating estrogen. Surgery is also an option, but is usually second choice for doctors if the medication fails to work. One study published by Personal MD showed that nearly 75% of cases that had tubal blockages were reversed by doing a fertility massage. For more information about pregnancy, click the link in the description below this video.